Good afternoon, everyone. My name is Kirkpatrick. I am the CEO of Avery Professional Group. We are a physician and physician leadership search firm with clients based in Ontario, Vancouver, PEI, Alberta, Washington, Oregon, and Missouri, all over North America. We work with candidates from the UK, from the US, and within Canada as well to try and build a global talent pool. So the reason you've tuned in today is I wanted to share the 6 steps or 6 aspects of a good physician recruitment firm. So what I will say is this is a high-level view, and each of these 6 you can dive into deeper and deeper to add more context and stuff like that. But to give you an idea of what that is, the 6 are building relationships with medical schools. So about 36% of physicians practice where they actually completed medical school. So what we want to do is make sure that we're building relationships with students that will become residents, that will then hopefully become physicians for us. So establishing partnerships with medical schools, offering rotations and electives is essential. That way they can significantly influence future physicians as well. And you can influence them, and they'll understand the environment, understand the culture. The culture of your organization and your community will drive how successful you are, right? So the other piece is developing connections with the residency programs. Because I think of last year, one community I worked with recruited 5 physicians, and all 5 had come through the residency program, not immediately, but they had come through the program at one point. So, collaborating with residency programs that can help you provide the training and help you meet your plan. So, if you understand that you're going to be requiring primary care physicians, and obviously trying to be as tied to residency programs for family medicine is a big deal. The other piece is building relationships with preceptors in your organization that will help you positively impact those relationships with the residents. So it's not just one thing to have a preceptor, it's having a good preceptor, right? And one of the hospitals I worked for actually had several preceptors that won the ROM Preceptor of the Year in Ontario. So, it builds a culture, and again, it builds an identity for your organization that allows you to see those fruits of those labor, and for people to see what your organization looks like. The third area is locums, and we're seeing a lot of sorry, I got a nicky nose today. We're seeing a lot of physicians want a locum. And part of that is they want to see what the environment's like, or they're just not at this point where they want to, take on a full-time practice and the responsibilities that come with it. For instance, one resident that I spoke to was going to locum until they were done having kids, because the notion of starting a practice and then trying to find a locum so they could take time off with their children was a bit daunting. So the individual decided to wait until after that point, right? So in 2021, approximately 20% of Canadian physicians were doing locum tenens. This is a study by CIHI, the Canadian Institute for Health Information, based in 2021. I'd be willing to bet that it's probably increased drastically over the last 2 years. There's just so many opportunities, so it's easy to locum. You're not having to scramble to find locums. So it is easy for them to find things. So letting locums explore your city, explore your hospital, show them what you have to offer. It's a lot more effective than a job ad or a flyer or a cold email, right? It's a lived experience that allows them to see what it would be like for them to live there. But it's also important that you try and support those locums as much as possible, right? So, Nunavut, who I did a webinar with a couple weeks ago, they have an office that coordinates flights, coordinates accommodations. Carly Cox, that I interviewed last week, same thing for the Yukon, right? So because they rely on a lot of locums, they've created a really strong service for the locums to make life easier for them, right? And anything you can do to improve the experience for the physician goes a long way, because it allows you to make it easier for them, and they can see themselves in a positive light, or see it as a positive light, as opposed to all of the hassles that they had to go through to get to that point. So the next thing, point number 4, is looking at engaging on social media. So social media is an interesting thing, and as we see physicians coming to Canada, let's say from other places of the world, Ireland, the UK, and the US for that matter, how we reach out on social media is going to dictate success, right? Whether it's Instagram to show the beautiful environment and amenities that you have, whether it's getting into conversations with physicians about your organization on Twitter. Twitter's a tough one because there's a lot of negativity. However, there are a lot of physicians there, so having conversations where you're sharing value is a big thing, right? It's not a case of just telling them you have a job, right? Share value, share the interesting things that are going on with respect to clinical developments, right? I talked to someone in Owen Sound, and their daughter had started a palliative care process to allow the family physicians to feel greater ability to support patients going through palliative care through their family practice, and not just a palliative care unit. Maureen, I saw your question about locum numbers by age. I do not have anything specific. I can try and find something through the CIHI data. The reality is, what I'm seeing is it's either the 28 to 35, so the first 5, 6, 7 years of practice, or it's about 55 to 65, the last 10 years of practice, where you've been able to get someone to take over your practice and you're jumping on that opportunity, but you don't necessarily want to stop working, right? So there has to be a bit of a lifestyle aspect to it for you, so you will continue to locum and stuff like that. And a lot of physicians are burnt out. I spoke to an anesthesiologist who resigned from her permanent position and was just locuming because she was looking to have a lifestyle experience and work in multiple places, as opposed to being in one place and stuff like that, right? So it seems to be based on the characteristics of the individual. So social media is an interesting one as well, right? Because there's two aspects of it. There's putting your information out there, but there's also having conversations. And I think what often gets lost is the amount of time it takes to have conversations and reach out to individuals that you don't know. It's easier to post an ad and hope that people see it. But where my firm gets a lot of our traction, to be honest with you, is people responding to content that we push out, like these sessions like today, as well as cold outreach, right? Reaching out to someone and trying to share information with them about what we're looking for, and about them, and trying to understand them and see if they're at the point where they're looking at different career opportunities. Sometimes it's as simple as sending LinkedIn messages that says, are you interested in other career opportunities, right? Or, if you see someone who's got the right credentials in the United Kingdom, it's, hey, have any chance you've considered moving to Canada? For our US clients, any chance you'd like to live in the South as opposed to the Pacific Northwest? Or, any chance you'd like to move to the Pacific Northwest, where it's a much more liberal environment, right? So it's understanding the behaviors of them and sharing information. The rule of thumb that I have told and spoken about in the past is content, ask. And the ask is usually a job ad. So put out content, put out some more content, and then ask if people know somebody for a job, right? If you're just putting out job ads, it gets lost, right? Because it's not engaging. And if you're not looking for that type of job, then the reality is that it's irrelevant to you. Whereas if you talk about how you implemented automated dispensing units in your hospital, and how it's reducing medical errors by 27%. I'm making numbers up. Then, that physician that works in your hospital might think, oh, that's interesting that they've done that. And then then you've got them engaged, and then they'll keep watching you. And then when they watch you, they'll see stuff, right? So the reality is you want people to engage with you. It's not about likes. Likes do not convert. It is about ensuring that you get engagement. I will take one person asking questions over 1,000 people clicking the like button, right? Likes and views and all that are more of a vanity measure than anything else. And then it's looking at data and where can you get data? Can you subscribe to lists? Can you create lists by collecting numbers and names off of sites like CPSO in Ontario or wherever, right? So there are different aspects, and you can, and college registration numbers and stuff like that, you can cross-reference those with people's social media and try and connect with people that way. Some of the other things to consider is just realistic transparency and timely response. There's no point putting content out if you're not going to respond to it and engage with people, right? Otherwise, it's just a blast and pray type of thing. So be prepared to communicate, answer questions, and stuff like that. Because when you answer questions, you're giving them more information than what exists solely in the job description. So again, you're moving them one step closer to engaging with you because you're answering their questions. And always think, what are the candidate questions that I need to answer? And that's what you put out, right? The number 5 is simplifying and improving your onboarding for physicians. This is a hard one because the Canadian Medical Association revealed that 50% of physicians are currently suffering from burnout. And given the average age of physicians, this is a large concern, right? So how we onboard physicians to our community is really important because we need to help them build sustainable structures, right? And that could be helping them, find the school for their children, or to, help them, get the right office space or join the right family health team or the right FO. Ensuring that, you get them a lawyer, an accountant, whatever it might look like. But it's also got to go beyond. Some people have told me, some physicians have mentioned onboarding where it's like, okay, well, here's your EMR password and username, and this is where the rooms are, right? So you're not engaging that community, that physician in and setting them up for success, which is paramount to their experience, right? And this goes back to locums as well, because the better experience the locum has, the likelihood they're going to come back. And if they come back multiple times, do you increase the probability that they're going to stay long-term, right? So, ensuring that they understand and are included in community events, introduce them to other physicians. One community that I worked with has a first 5 years family medicine Facebook group, right? And it's a case where the family physicians that have been there under 5 years, nobody's timed out because it's only been around for a few years. So I don't know what their policy is after the first 5, but they're there to answer questions. They're there to socialize. They're there to, support each other, right? If the community can, or the hospital can do that type of things, then it goes a long way, right? And, putting on educational events that are relevant to the physician, right? Everybody wants to go axe throwing and stuff like that, but it's got to add a value to the physician. So it can't just be a social event or an excuse to get in front of people. It's got to be adding value, right? I put on a session for pensions and it was relatively well attended and they enjoyed it. Whereas we've also put things on about social media and got much greater exposure to because it affected them more, right? So, providing a structured onboarding process that can mitigate the burnout risks for these physicians and contribute to their overall well-being. My philosophy in healthcare is that if we cannot improve the experience for the professionals, healthcare professionals, whether it be physicians or nurses, until we can focus on improving their work environment, we'll continue to struggle to find them. And lastly, this is not really a recruiting component as much, but offer efficient retention and support for career development, right? One of the hospitals I worked with gave every nurse $1,000 a year towards a course. And it doesn't seem like a lot of money, but when the average additional qualification is like $500, they can get a course a year, right? So if you're a nurse on a medical floor, you may choose to take courses over 3 years to do your critical care certificate. So what's going to happen then is you're going to apply to jobs at your organization in critical care because you don't need to get the training somewhere else because you got it there. The same thing for physicians, right? If we want to ensure that they stay with us, we need to understand what interests them and how can we create an environment for them to do that with us, whether it's, moving into addiction medicine or occupational health or, palliative care, or, they want to do OR assist and they're not comfortable. Like it's how do we allow the physician to grow their career within our community or hospital, right? Because if they don't get those growth development and they want it, they're going to go somewhere else, right? And considering education around, do we want to do education around billing practices, right? Or do we want to do things around how to do research, right? Like, maybe your hospital is small, but you want to do research on the effects of Ozempic and diabetes, right? So, you decide that you want to, do that and look for funding and stuff like that. Or you want to do research around, chronic heart conditions and some form of intervention, right? So it's allowing you to grow and stuff where they are, as opposed to having to grow somewhere else, right? If someone's burnt out, they may choose to go somewhere else for a change of pace, or they may choose to do something completely different. If you want to leverage your workforce in your community and hospital, finding ways to do that development, and it could be simple. It doesn't have to be, massive undertakings, but Schulich, one of the hospitals I work with, Schulich, does a health administration certificate. So physicians would take part in this, and there's a time commitment, but they would end up getting a certificate in healthcare leadership, right? And it was delivered in the hospital campus. So it wasn't like they had to go to London or anything like that, right? So it was just facilitating their growth, right? And other aspects might be, succession planning and leadership, and also then ensuring that you're building your next chief of emerge or your next chief of staff, and investing in those components and corporate projects, and involving the physicians in projects that can help them grow their career so they can be in a position to do a leadership role, right? So, I think that's the key, right? Is if we retain people and they're engaged, then they will precept new physicians and residents and locums. We don't need to precept a locum, but they will, support locums and stuff like that as well, right? So engagement is the key. Engagement is the key in our social media. It's the key in our onboarding, and it's the key in retention. Everything is about the relationship and the engagement. Some of the best recruiters build really strong relationships with their hospital or their community, their physicians and their candidates, right? So it's a notion of focusing on building those relationships so that you can communicate information across the board and head off any problems that might occur. So if we're looking at a recap here, as I'm sure you're getting tired of hearing me, big thing is medical students, getting them to come for electives, getting them to follow you, to follow your physicians and see what's going on, so that you have a brand and you have a identity with them. Number two, residents, right? These residents are potentially going to locum with you when they're done, and then eventually stay, or they're going to stay right after residency. But if they've spent several years experiencing your community, the likelihood they go somewhere else is less. They also provide a breath of fresh air into your organization and into your community that makes it a little bit easier for people to stay. Again, we talked about social media and ensuring that we're putting our best foot forward and responding and putting out content ask, so that we are not just asking for help, right? Give, and then you will get. Simplistic from that standpoint. The other piece is locums, trying to make it a seamless and an easy locum process for them to come to your community. Show them the best time, and hopefully they will stay. But the ulterior motive is they will also tell their friends about it, right? There are places like Moose Factory that, they get, from what I understand, they get a lot of their locums just from word of mouth, right? And I've talked to physicians that still locum in Moose Factory, and they continue to do so because they enjoy the environment, right? So then it is our fifth one is really the onboarding, making sure that we support them as they come to our community. Make sure they have all of the supports, and their spouses or partners have supports, their children have supports, because engaging them and making them become part of the community will go a long way to their job satisfaction, which then in turn increases retention, right? And then lastly is my retention spiel. It really comes down to ensuring that they can develop with you and they can develop their career with you without having to look for something somewhere else. And that takes polling your physicians and building a relationship with them. Moose Factory is a place in Northern Ontario. Sorry, Aaron. It's a great place to practice. And then just allow them to build and grow and get change within your community, so they don't feel the need to look for something elsewhere. Isaac, I see your question about getting involved in locums. There's multiple steps to that. If you want to reach out to me on LinkedIn, we can have a discussion about how I got my firm into locums as well. We do locums in Canada and the US, so there's a bunch of different aspects there. So I'm happy to talk to you offline, because a bunch of that's probably not relevant to the other people listening in. So in closing, everything's about engagement, right? It's better to have engagement with one person than just have 50 people see your posts and stuff like that, right? So, leveraging LinkedIn, leveraging Twitter, leveraging Instagram, looking at tools like Sourcewell for messaging, or using an ATS like Crevate to manage relationships. There's a lot of different technologies to support the process, but the process really is engagement, right? And getting your message out and answering as many questions as you can about your organization, and listening to what the physicians say and what they want, right? We usually spend about an hour on initial calls with our physicians, trying to figure out what they're interested in and why they would be interested in looking at a change, right? Because understanding their motivation is a key to determining whether or not they will actually move and come to your community. And I apologize, my ADHD is killing me with the comments off to the side here. So, Aaron, I live in Ontario and do work right across Canada. So we've placed physicians in almost all provinces, as well as I've done some work up in Nunavut, placing physicians there. So we're kind of Canadian based in one hand, and then starting to work with clients in the US as well. So either way, thank you, everybody. If you want to call or text or reach out, my number is 905-447-2151. You can also reach me at kevin@averyprofessionalgroup.com. Happy to trade notes, happy to talk. One of the things I have been doing is providing some time and consulting services to organizations that want to look at how they do things now and can they do it differently, or in some cases building it completely from scratch for somebody. So we're around. Have a great day, everyone. I gotta find the end button.